Welcome back to the TEDMED at CDC. Our next speaker is Dr. Frank Rasler. He's an emergency physician at the DeKalb Medical Center here in Atlanta. His topic today is entitled Health Behavior Motivation, Inspire Yourself First, Then the World. Dr. Rasler.
Hi, I'm from the intervention side of healthcare, but I believe more in the prevention side. I'm an emergency physician from just down the road at DeKalb's emergency room. And I brought along this example of prevention just to wake you up a bit, get you interested. He wasn't wearing his safety harness, so this poor soul fell from a crane and skewered himself on a telephone pole. Now, Hollywood TV dramatizes the ER with scenes like this, blood squirting everywhere, or saving the patient in cardiac arrest. In the ER, we only have time for rapid and brief intervention and even less time to talk about prevention. So I try to help patients change unhealthy behavior rapidly. Now, I love my job, but sadly, I think about half of everything I treat is preventable. Now, in public health, you see the big picture. Instead of a few dozen patients a day, it's 10,000 or 100,000 patients. Well, I want to turn that around for a moment and remind you of the human perspective instead of just points on a graph. I have the honor and the burden a few times a week of delivering the bad news, the new diagnosis of cancer, or explaining to the family how their loved one died suddenly. I don't think we need more studies to tell us that smoking is bad, exercise is good, or what we eat is important. Instead, we need to figure out human motivation, behavior change. Make healthy living an easier choice, more attractive, more compelling, and less expensive. And yes, some patients are just lazy, others don't want to spend money on a health club, but junk food, beer, and laying down watching Netflix is cheap. We need to help them get started. However, as usual, we need to look at ourselves first and ask the question, is the CDC's philosophy of prevention also part of your own philosophy? I know it sounds cliche, but it's true. How can you effectively advise the world if you don't practice it yourself? Now, speaking to the CDC about prevention should be like preaching to the choir. You guys are already believers, aren't you? So examine your own health risk behaviors now. Where do you need to make changes, and how do you do it? Now let's put your imaginations to work. Assume you've been working here at CDC for many years. You're looking forward to a long, happy retirement with golf or travel. Instead, you end up with an early death, or chemotherapy. Or imagine a stroke that leaves you paralyzed in a wheelchair and drooling out the side of your mouth. What went wrong? Well, positive thinking people prefer not to think of it, but those potential destinies are out there waiting for you. Now, these ideas are uncomfortable, but right along with being extremely happy or successful or make a lot of money, you need to have a detailed plan for your health and longevity. Otherwise, you're just going to lose it all. Now, a few years ago, I did an emergency room project to help cigarette smokers quit during the critical time phase when they're near death from a heart attack or difficulty breathing. Those hours can be an extremely motivating time to end the smoking habit, and everyone magically becomes a great listener. Now, I call it the near-death experience, which I'll demonstrate for you. I've seen it work many times. And the alternative, of course, is the real death experience, which I do not recommend, even though it is always 100% effective in changing your behavior. Now, I'd like you all to just join me for a brief example of a negative type of visualization. Usually when we visualize positive images. However, we'll often do more to avoid pain than we will to gain pleasure. So I'd like you all to just close your eyes for a few minutes, or try it later tonight if you want. Everyone just close your eyes, and take a deep breath, and imagine yourself a few years from now. You've worked hard, achieved some of your dreams, you've got family, good friends, vacations, a happy life. And then it happens. You start to feel an intense pressure building in your chest, and it's hard to breathe. Now you're lying in an emergency room bed, having a big heart attack. Now add some vivid details. Make it seem real. You hear a heart monitor beeping in the background. Your nurse looks worried. Nearby, your family members saying a silent prayer for you. And you feel like you've just climbed up 6 flights. Can't get enough air. You're sweaty. Your heart is racing with intense pain. You are perhaps as frightened as you've ever been. You think, if I can just get through this, I'll quit. I'll change. Or, please, God, help me. I don't want to die. And then you hear, we're going to get you through this, but you need to decide. Commit right now to end the bad habits that brought you to this crisis, whether it's obesity, bad food, lack of exercise, smoking, cocaine use, or poor control of your blood pressure or diabetes. Next week you'll realize, boy, that was a close one. Scared me to death. But right now, promise yourself. No, guarantee yourself that behavior is over. Now, open your eyes. I call this the motivational moment. In times of absolute crisis, it's actually easy to motivate and change behavior. So now ask yourself, why do I need to wait for that near-death experience? It's just 1,000 times better to make the changes years ahead of the crisis. Guess how many times a year I have a newly diagnosed lung cancer or heart attack patient who's able to quit smoking? Congratulations, my friend, but I'm also thinking, too bad you just didn't do it 5 years earlier. So let's start. Draft it on paper today, and in detail tonight, make your list. You need to do it. Set a goal, make a plan, and incorporate health and fitness in the rest of your life. But don't think of it as changing behavior. Instead, begin a new project. Just as if it's a hobby or a challenge, it's a good thing. It doesn't need to be painful, and then you can make it long-lasting. And let's start with exercise. And I know some of you will instantly groan just at the thought of it. And how many of you have no plans to even do any exercise at all this week? If you don't enjoy exercise, you need to change your perspective. Make it fun. Use sports, hiking, dancing, music. Have a partner, get a personal trainer, multitask, and watch TV if you want. But you must invest time in being physically fit. And what if you say, I just don't have the time? Then start with just 10 minutes 3 times a week and make the habit simple. And is there anyone out there who can honestly say that they don't have 10 minutes available 3 times a week? We need physical fitness. Here's a 24-hour fitness club with up and down escalators just to make you smile. Only in America. But how many hours do you spend sitting in front of your computers or at meetings? All right, next on your health list. Put down the top 3 issues specific to you. Maybe you've tried for years and given up. If you know you need to change it, then put it down. This is your life we're talking about. Is it your weight? We know that obesity and diabetes are preventable epidemics. What should you model with diet and fitness for your families to follow? Show them how it's done. At restaurants, set the example and order healthy or choose a healthier restaurant. What's in your kitchen? It's easy to find meals like this with 3 days' worth of fat in it. And for some of you with just mild obesity, sometimes the starting secret is quite simply just eat less and less junk, and begin your meal with a full glass of water and a salad to fill the stomach up and decrease your hunger sensation. All right, now, just for a bit of fun, let's see with a show of hands, who out there feels they have just a little bit of a problem with loving chocolate? Lots. All right. How about alcohol? Not too many willing to admit that. All right. How about who would just like to go on that healthy, delicious red wine and dark chocolate diet? All right. Questions get a little more difficult now. Do you feel you miss out on joy in life because of depression, stress, grief, or family problems? And do you perhaps need to get professional help? How's your life? Many successful people don't have successful personal lives, and they avoid working on it. If that's you, put it on your list. And how many hours do you spend in front of the TV or the internet taking in negative stories? And we know that 1 out of 5 of us will die with some form of cancer. Ugh. Well, we know about risk reduction with diet and fitness, but also early detection, breast exams, rectal exams. They're simple, effective, and frequently ignored even by healthcare people. And if you have a problem with alcohol or an addiction, I don't want to minimize the difficulty in quitting, but you will definitely need to replace it with something: meditation, religion, a new purpose in life, or professional help. Now, some of us will be driving home tonight distracted by those cell phones, or perhaps you just drive too fast or after alcohol. And bicycle helmets, many intelligent parents don't make their children wear them. And in the emergency room, we see a lot of back pain, often accompanied by pain pill dependence and depression. So what can you do now? Of course, weight reduction and fitness, but also think of your posture, lifting, bending correctly, and how are you sitting all those hours in front of your computer or at meetings? So choose the health issues that are specific to you, and then discover your motivational power. Take some time tonight and think about why you want to change. For example, one patient told me his motivation was thinking that after death, all his hard-earned retirement money would be enjoyed by his wife with a new partner. Or his kids blowing it all in a couple of years of wild partying. So yes, inspire yourself. It's powerful. Also, love the idea of a healthy, long life by planning your future and the type of person you want to be in your retirement. All right, so let's say you've made the changes. How do you keep it going long term? Well, sometimes we are impressive with the right inspiration. We can just flip a switch in our brain and make permanent changes. Maybe it'll happen to you. Maybe you are ready for an amazing change. But don't get upset if it doesn't happen that way. Don't give up on your plan if it doesn't work immediately or if you fall back into old habits. It's okay. Use the near-death experience concept and really visualize yourself lying in an emergency room bed or getting chemotherapy. Feel the sadness of a preventable disease. Many people permanently change after they realize they almost died. But many people don't. We get lazy. Well, begin again. And this is important. Most people need repeated attempts before they make permanent changes. That's just the way we are. We need effort and persistence. Health, if you're blessed in having it, is a gift, and it's your responsibility to maintain it. And we know that unhealthy stress and emotions weaken our immune system and ability to heal. But 6 months after you begin regular exercise, you will have all those things you want. You will definitely handle stress better, have more energy, more resilience. You'll sleep better, and you'll probably look better too. Stress is also helped by meditation and prayer, and so is your heart, intestines, arthritis, cancer. If you're too stressed, put meditation on your list and try it. Now, continue learning how to manage your stress. Get yourself ready, because wherever you are in life's journey, and I hope it's wonderful, but you need to mentally prepare yourself for an occasional disaster. But at the same time, you want to be having more optimistic thoughts in life, not pessimistic. How you look at life as a choice. Focus on the good, be hopeful, and you can choose to look at other people in a positive way. You'll be a happier person. Less stress. People enjoy being around you more. And you will be more successful at maintaining these new and healthier life habits. And finally, somewhere on your health list, some of us, yes, need to look at love and giving to others. Love and giving helps your immune system, helps depression, and helps other people. So think about where in your life you want to love more. Is it here at CDC at your job? Love just being healthy. And love the people and family around you. Your relationships are precious. Honor them and repair damage when you see it. And perhaps even more important than giving is forgiving. Forgive others and forgive yourself for whatever you did or didn't do in life. Forgive yourself. Now, we can all benefit from this. Share it with a friend who needs motivation. But now, today, make a healthy life plan that you want in your future. Do you need to change everything overnight? No, of course not. But change your direction today away from that preventable heart attack. And lower your risk of cancer and be happy and healthy and energetic and optimistically looking forward to every year. Yes, get started. You can really do this. Thank you.
Dr. Rasler, how would you tailor the message you just gave to a child audience?
Well, child audience, certainly a different thing altogether. Children have a much different outlook. They're certainly not worried about depression and stress. And I guess if we're talking about trying to inspire themselves, a good example would be with smoking. They're not worried about heart attack or strokes. You want to tailor that to what's important to them: bad breath, annoying their friends, the money they waste. So it definitely is a different issue. We're all going to grow up to be older someday, but getting children even to learn about handling their stress at a young age is so important. Stress can hit us at any time.
Thank you very much.
Thank you.